So I'm here with Renee Heffron, who's an epidemiologist with the Partners PrEP study at the University of Washington, and really an expert in what we know and what we don't know about HIV and contraception. So I'm going to ask you, first of all, a question from, say I'm an HIV positive woman. What should I consider when I'm thinking about contraception and hormonal contraception?
Sure. So the good news for women who have HIV is that we don't see any effects of hormonal contraception on disease progression. You know, how quickly they might have a low CD4 count or need to start ART. We also don't see, in terms of depot, we don't see any interactions with depot and any of the antiretrovirals, so they'll both continue to be as effective and work well and not have any extra side effects in a woman's body. It is important for her to consider her risk of transmitting her infection to male partners. There's just a very little bit of data about that so far, and it's hard actually to collect those data because you need both the woman and her partner in the studies. But we don't. It would be important for her to just consider the risk of that, and if she can, discuss with her partner, and that might help him to use condoms more. Also, if she's using antiretrovirals, of course, that will lower greatly her chances of a severe infection, no matter what. You know, if she's on any hormonal contraceptive.
Great. So it's lots of good news.
Yeah, lots of good
Talking
news.
with my provider would be the number one.
Yep, and definitely bringing it up with a provider and asking the provider to sort of review the data and help you understand what it all means. It's really important.
All right, so let's switch scenarios and say I'm an HIV negative woman and my partner is HIV positive. So what am I thinking about when I'm thinking about contraception?
Sure. So there are so many options out there about contraception for women. The only data so far that are making people sort of think harder about HIV infection and hormonal contraceptives is some data about Depo-Provera. And the data are inconclusive. And the guidelines from the World Health Organization and the CDC in the U.S. are that it's fine for women at risk of HIV to use Depo-Provera, but that they should also use condoms at the same time. And remember that.
And so the Depo-Provera is working for me for the contraceptive piece, but I need the condom to work for the HIV prevention piece.
Exactly.
So that's why you're recommending two.
Right.
Okay.
Exactly. There are, for women, I think it's important for women at risk of HIV to consider, to figure out, to talk with their provider about their risk. And there are ways that they can reduce their risk. So condoms is one thing. If their partner is using antiretrovirals and adhering very well to them, that's another thing that will really reduce the risk that she get his HIV infection. And then another thing would be for her to talk to her provider about pre-exposure prophylaxis or PrEP, which is available for use on prescription in the U.S., and that would really reduce her risk of getting HIV too. So those are some things she can consider in addition to using condoms and think about how that would help her.
That's great. So when you work with so many couples, do you have any tips for couples? So sometimes early in the relationship, it's hard to figure out, you're navigating the disclosure of HIV, and then you may have desires to have a child in the future, but how is it that you can deal with this contraception conversation up front?
Yeah.
And so in your experience working with couples, do you have tips for couples, for both men and women, about how to engage in this conversation?
We have a really famous discordant couple in America. That's Magic Johnson and his wife, and they've been a discordant couple for, over 20 years now, and they're a great example of a couple coming together and deciding early on to really go at this infection together and be a team. So that's just a nice, I think, example to remember. But I think that as hard as it is, starting discussions as soon as possible and as open as possible really helps. I mean, it helps relationships on all levels, on all different topics. But if you can open the door and really develop that framework and sort of the patterns for talking with your partner about contraception, about condoms, eventually about maybe plans to have a baby, all of those things, it can really help, and the more the better.
Good point. And I'll put a plug. We have a brochure on our website, which we'll link to at the end of this video.
Yeah.
That's for HIV positive men about preventing pregnancy and HIV. So we have that, so we need to make one for their partners. That's our next one.
Good.
Okay, good. All right, thank you so much. I appreciate this.
Sure.